Hey guys, it's Jake here again and welcome back to my channel. So this week there was a video released by Stenberg College in Canada of a clinical instructor, one of their clinical instructors, comparing nurses back in the Philippines and in Canada. This was meant to be a promotional video for the college, but as it turns out, 90% of the things said in that video was shaming Filipino nurses in general. It was defamatory, it was full of lies, and even if you say that was from her personal experience, it was not the right thing to say because you can't generalize for all of the Filipino nurses. And I could not just sit back and watch. I had to make this video and react to everything that she said. How could they think this video was promotional? Why couldn't anybody from the camera crew to the shoot director, to the editor, and to the media or marketing team stop this video from coming out? It seemed like everyone who was part of making that video thought that it was okay to say those things. Yes, they may have a high-tech skills lab and high-fidelity mannequins, etc. But this video just shows how much they lack in good judgment. This was a very big mistake, one that made Stenberg College famous all over the world, but for the very wrong reasons. This just shows that even if you have so much knowledge and so much skills and you have the most high-tech materials, equipment, or whatever you need for training, the most important thing is your heart, your attitude, and your values. That is the most important thing. So now I'm going to go through the 5 statements of Nurse Jackie G and tell you what exactly is the truth. This is all based on my experience and my colleagues' experience, both in the private and public hospitals. So let's start. So number 1, professional communication. Nurse Jackie G says in the video that we rarely speak to our patients, we rarely speak to our doctors, and even to our colleagues. Now, first of all, I don't know how you, Nurse Jackie, manage to do your work without communicating at all. The word there is at all. Yes, there may be times that we are so busy that our communication may be minimal to the patients only at certain times, but when you say at all, means like 90% or even 99% of the time we don't communicate to the patients, which is definitely wrong. I don't know what kind of experience you have, but as for me, we have very good communication with the doctors. Sometimes even the doctors join us for drinks after work. They even join us for our personal parties, and we have very good communication with the doctors. We update them if there's any problems with the patient, if the relatives are unable to buy the specific medication, is there an alternative medication which is much cheaper that they can afford, or what are the other options that it could possibly have. Even when the patient's safety is not at stake, we communicate very, very well to our patients and to the relatives. Sometimes, nurses even know the names of the family members of that patient and even their kids. Yes, it goes down to that level. As for my experience, I was working in a private hospital. It was very important to greet our patients and relatives when we enter the door. So I was working in a private hospital. They have individual rooms. When we enter the rooms, we have to knock first, and then when we enter, we have to say a greeting. For us, it was peace be with you because it was a religious hospital. But for other hospitals, it's a greet of good morning. And of course, you have to tell the patient or the relative why you are there, what you are going to do, and what it is for. If there is a certain point where it becomes too technical and becomes too difficult to explain, then that's when we say, I'm gonna ask the doctor when they come to speak to you. In terms of communication to our colleagues, after the handover, we even do our own individual nurse-to-nurse handover for those specific patients that we are covering for the shift. If there are any extra things that may not have been mentioned in the general handover. This may cover things like which medication needs to be chased, which observation is due next, or it may be a warning that the relative of this patient may be very meticulous and you have to really be very, very careful of what you say and what you do. So things like that. So definitely we have excellent communication. So I don't know what you are saying, Nurse Jackie. I don't know if that is your own personal experience, but that is not happening anywhere else. As for consultant doctors, it is true for junior nurses, we may not speak directly to them just because we are too busy, but the charge nurse have a very, very open communication to the consultants. And the consultant themselves, they talk to the junior nurses because they are the ones who are actually caring for the patient and ask them for specific things. So yes, we do communicate with consultants as well. Number 2, according to Nurse Jackie, we don't get to practice our skills in assessment. Again, she uses the phrase at all. She says, we don't complete the nursing assessment at all. Again, be very careful with your phrases and your words, Nurse Jackie. Back when I was a student, every time we have a clinical exposure, we need to fill in this 6-page form to assess one patient for every shift. By the end of our 4-year nursing degree, we have those nursing assessment questions and skills memorized and engraved, not just in our head, but also in our heart. So, don't tell me that we don't do the nursing assessment properly. In my work experience, most of the time, it was us nurses, not the resident doctors, not the medical students, not the interns, and definitely not the consultant who saw the different signs and symptoms and reported it to the doctors so that they could treat them. So don't you dare say that we don't practice our nursing assessment. Number 3, specialization. She says this month we're working in ER and then the next month we are working in another area and therefore we don't have specialization. Now, Nurse Jackie, if you don't know what this is called a clinical rotation. And this is practiced not just in the Philippines, but in other countries as well. And definitely it is practiced in the UK. So when you are a newly qualified nurse and you don't know yet where your heart really is, there is an option for a clinical rotation. It may vary per hospital, but in some institution it's 6 months period. So 6 months you work in the medical ward, the next 6 months you work in the surgical ward, and then the next one will be in the outpatient department. And then at the end of that, you get to choose which area you want to work in. And just because there is clinical rotation doesn't mean you don't get the specialty training. That is exactly what happens when you go to a special area. You go to seminars and trainings which is specific to that area. And when you talk of specialization, the Philippines has a lot of skilled specialist nurse. We have renal transplant nurse, we've got cardiothoracic surgery nurses. In my hospital alone, we have a cath lab, and we have specialized cath lab nurses. They go through a proper and full training of their roles during procedures. They get trained on how to use the machines and of course on how to document things that happen during the procedure. So Nurse Jackie, don't you dare say that we don't have specialization back in the Philippines. Let me ask you, if you were very sick and you have this, let's say, kidney problem, would you rather have a skilled Filipino nurse with experience in a kidney transplant institute or a specialist hospital back in the Philippines, or a newly qualified nurse who has this special training and education for that specialization, who was trained in Stanford College? Number 4, technology. Nurse Jackie says that the machines are different in the Philippines to the machines in Canada. Now, of course, this is going to be different. We don't have the same financial capability. We don't have the same budget back in the Philippines, but it doesn't mean we don't have the specialist machines. Let me tell you how this is true and how this is not true. Her statement can be true if you are talking about far-flung hospitals with very low funding. You would not expect them to have specialist equipment. And that is why we have these tertiary hospitals who have this specialist equipment, okay? And that's why we get referrals from these primary hospitals to the tertiary hospitals because they need the special treatments and equipment. But her statement is not true if you talk about private hospitals in the Philippines. Mind you, the private hospitals in the Philippines is a very competitive market. Most hospitals nowadays can compete with the equipment that other countries have. As for my own experience, I've already met and knew how to use the Baxter pump, the syringe driver, the cardiac monitor, defibrillator, and more. One possible reason why some nurses may not be able to see this equipment for their patients is the cost. As you all know, healthcare in the Philippines is not free. You have to pay for every single thing, whether it's the specialist equipment or just your syringe and needle in order to draw up and prepare your antibiotic. Everything has to be paid by the patient. So instead of paying thousands of pesos for a Baxter pump to regulate a medication to run for, let's say, 6 hours, 8 hours, they would rather use that money to buy the actual medicine. And this is where the Filipino nurses' ingenuity, creativity, and resourcefulness comes in. Just imagine the level of monitoring we have to do to make sure that this IV infusion completes in 8 hours without any use of a pump. So we have to compute the actual flow rate by drops per minute depending on the giving set that is being used. So we have to go to the patient loads of times to make sure that the rate hasn't changed because the patient has changed the position of her arm, that it hasn't changed because the patient was playing with the roller clamp, that it hasn't changed because it was accidentally touched by a relative or closed by a relative or anything like that. So imagine the amount of time and the level of monitoring that we have to do in order for the medication to go in without using a pump. So here in the UK, when we give medications that may cause altered cardiac rhythm, so for example, amiodarone or magnesium, we need to have the patient attached to a cardiac monitor. Now imagine, back in the Philippines, instead of paying thousands again to use that cardiac monitor, the nurses are the ones who closely monitor. We become the cardiac monitor. We monitor the patient's observations and make sure there are no signs, no external signs of cardiac dysrhythmias. Just imagine the amount of time we give to that and the level of skills you need to have in order to properly monitor that patient. Nurse Jackie also mentions that they have things prepared in kit. Wow, amazing. She even says that if we need to do a procedure, then we have to get this thing from there and we have to get the other item from this department and all that. Whilst in Canada, they have everything in a set. Now, this may be true in poorly funded government hospitals, but in private hospitals, we also have these sets prepared. Now, in the first instance where we don't have a kit, it's mainly because we try to go for the lowest cost. So instead of buying the specialized kit somewhere, we list the items that are needed so that the patient or the relative can buy them cheaper in different pharmacies or stores. Again, it all boils down to the cost. But again, this is where the resourcefulness of Filipino nurses come in. So sometimes they may have a contact in a different ward who has saved, say, this item from a procedure that was done before, and then the patient didn't need it anymore and it was donated to them. So one nurse from the other ward will call the other ward and say, oh, do you have this equipment? We need it for this patient very badly. If she doesn't get this procedure, she's going to really deteriorate. So this is where communication is very good between colleagues, Nurse Jackie. And because of this good communication, we manage to find the things that are needed without splashing on the cost. Okay, number 5, patient communication. So yes, she repeats it again for the number 5. She says again that when we give IV to the patient, we don't explain at all. Here we go again with the phrase at all. Now this is 100% not true. Before we even get the materials to put up the IV fluid, we have to talk to the patient or to the relative for them to buy it. And we have to explain to them why it is really needed. So Nurse Jackie, yes, even before we put up that fluid, we have already communicated to the patient. In the Philippines, it's true that consultants don't stay for long in the hospital. It is usually the resident doctors who look after the consultants' patients. Now, with their long hours doing 48, even 36-hour shifts, there is always the tendency for them to be a bit disorientated sometimes, or maybe a bit sleepy. So there may be like small errors in the prescription, and we Filipino nurses are very good in catching that. And that is why, if you've ever worked with Philippine nurses before, we are very quick to find something wrong in a prescription and have it corrected. Sometimes even new resident doctors would ask us nurses how to prescribe the medication. When the patient is embarrassed, or let's say they are underprivileged and they are embarrassed or shy to speak to the consultant, we become the messengers of what they want to say or what they want to challenge in the consultant's decisions, treatments, or prescriptions. So yes, Nurse Jackie, we do communicate very, very well to the patients, to the consultants, and to our colleagues. Their point number 6 in the video was the only promotional thing I could see in the whole duration. It just showed that they have high fidelity mannequins and that they have a skills lab. Well, let me tell you, we also have skills lab in the Philippines. In my university, we have this whole floor of skills lab, and we also have high fidelity mannequins. There are also a lot of private nursing schools in the Philippines that have very, very high-tech skills lab as well. So yeah, it's not just you and your university, Nurse Jackie. We have skills lab and equipment too. And that sums up my counter arguments to everything that Nurse Jackie G has said in her video. I think there are a lot of things we have learned from this mistake by Stenberg College. One of them is that you must never step on someone or a group of population in order to promote yourself. If you want to get yourself known or prestigious, then you have to show it with your results, not by bad-mouthing other people. Another thing is your skills, knowledge, specialist equipment is of no value if you don't have the right attitude. And lastly, if you can't say anything good at all, then don't say anything